Well, good morning. I'm Nancy Muir from Miles for Hips and have the pleasure of being here today with Stephanie Madison and Kelly Moore, who are the co-founders of the Pediatric Hip Dysplasia Action Network, which is an amazing emerging organization and that I've had the privilege to get to be a part of and get to know these wonderful women through. So Stephanie and Kelly, I will let you all take it away. And I would love you both just to share a little bit about your backgrounds and what brought you to be interested in hip dysplasia.
Well, we are so grateful, Nancy, to be here chatting with you today on the Miles for Hips channel, and we're very honored for the opportunity. I can talk a little bit about my daughter's diagnosis and how it led to my interest in hip dysplasia and desire to enter advocacy. So my daughter, she was 3.5 years old when she was diagnosed back in 2021. Um, I had been vaguely aware of hip dysplasia and the condition. I had even bought a hip safe swaddle and knew that there were proper and improper ways of swaddling. But I didn't really know much more about the condition than that, even though I had done, what I felt like was a significant amount of research and preparation before giving birth, and then also reading all, the baby books after giving birth as well. So I really started noticing issues early on, and so did all of our family members, really, with pointed toes, a leg length difference, issues with delayed walking. I had brought these concerns up with my pediatrician over the years. But to be honest with you, as a first-time mom, my anxiety was high about almost everything. Every little minor cold or sniffle she was brought in to the pediatrician. Is this okay? What should I be looking for? And so when I brought her in for, walking issues or something like that, if he told me it was okay, which he did, and that he wasn't concerned at all, I decided to trust him, and I put that really out of my mind. Honestly, until I couldn't anymore, because she started falling down when she was running over kind of uneven surfaces and grass. This was during COVID, so we were pretty isolated, but I very distinctly remember, going on a vacation with friends, and all the kids were playing soccer and all the other kids were running across the field fine, and my daughter kept on falling. My friend was like, "Oh, she has such a cute walk." And I said, "No, I think something is really very seriously wrong." So I recorded her walking, and I brought that recording to the pediatrician, and I said, "I know you keep saying she's fine, but I don't think she is." And Nancy, I'm going to try not to cry. But he saw that video, and he then referred her to a specialist. And then that day at the specialist was honestly one of the worst days of my lives. I was still very naive, I think, in taking her to the specialist, and I had thought that maybe we're going to just walk out with, a special pair of shoes. Maybe it was like some hopeful thinking. But instead, I had in my hand an X-ray, and it showed that her right leg was completely dislocated, and it had been dislocated for really such a long time that it had worn down her hip socket. So she had no right hip socket for her leg to go back into. And I think I was just speechless, understanding the severity of it by looking at that X-ray. And I remember the tech or somebody, seeing kind of my state of shock and asking me if I was okay, and just saying, absolutely not, I'm not okay. So we went ahead and we found Dr. Sankar at Children's Hospital of Philadelphia, who was really spectacular. He performed a triple pelvic osteotomy, shortened her femur, cut one of the tendons. And then she was in a spica cast for 6 weeks, a brace for 2 weeks following that. And really that time was so difficult for us, and it was difficult for her, for the entire family. Family who had noticed issues over the years, friends who had been there as well. But we tried to make it fun for her, and persevere through that time. Had friends over for stroller races and um, did karaoke, late night karaoke. If she woke up at 2 a.m., couldn't go back to sleep from a muscle spasm, we watched TV together. Um, and so now, after, it's 2025, many years later, she's 7 years old. She's doing incredible. But her prognosis is osteoarthritis, and it's a total hip replacement. Dr. Sankar hopes that the surgery gets her to the age of 40, but that hip replacement or other surgeries could come much earlier, maybe as early as her teens. So I have found this interest in hip dysplasia because this is my, precious daughter's life now. This is her past. It's been such a defining moment for her, oof, and for us. And it is very much her future. This is a lifelong diagnosis for her. And so it is a lifelong diagnosis for us as well as a family. So I'm trying to help her process her past, look towards the future kind of with hope. And I'm hoping that, our work together and involving her in this work and hearing similar stories and understanding what the future looks like turns into a story of empowerment for her and us really as a family.
You're gonna make us all cry.
So,
Yeah. I tend to bring
And
tissues. Yeah, it's a lot. It's a
it
lot
really is.
To think about how far you guys have come, that's the beauty of it.
Yeah, that's right.
Oh, yeah. And with your strength and encouragement, it helped me get through my granddaughter's story. So my situation, I am the grandma in this situation, which is a bit different. But my granddaughter, her name is Ruthie, and she had a very similar story to Coco. When she started walking around 13 months, so not a true delayed milestone in that respect. When she first started walking, she was limping. And of course, a new toddler gait is not always, smooth. But it was definitely noticeable. Something I brought up to her parents very early on, who in turn brought it up to the pediatrician. I really never had that exposure to the pediatrician. In retrospect, I wish I would have gone to an appointment or two because I probably would have pushed a little bit harder. But they took the watch and wait approach for a long time. She started walking at 13 months, and probably around, 3.5, I was visiting. I don't live in the area. And she and I were sitting on the floor together in a cross-legged position, and her left leg, her left knee was like 45 degrees in the air, and her right leg was, probably, I don't know, almost flat to the floor. I can't think of degrees right now, but and I was like, wow, okay. So I pulled her dad over and I said, this isn't normal. And the reason why I am saying this isn't normal, I'm a nurse practitioner. I've been a nurse for 30 years. So, my background in healthcare, and granted, pediatrics is not my specialty, but family medicine is. And so, it wasn't right. And then her gait was still limping. Fortunately, she never complained of pain. Her mom recalls maybe one time mentioning that her hip hurt one night before bed, but it could have just been an overly active day. So at around her, well, it was her 4-year well check, after that, 3.5 year visit that I had, they brought it up to her pediatrician, and the pediatrician finally agreed to order an x-ray. I think my pushing and persistence, helped mom acknowledge that maybe there was something going on. And sure enough, the day that they got the x-ray, her mom sent me a screenshot of the radiology report along with the x-ray, and her left hip was completely dislocated. like Coco, she was starting to form a new acetabulum up in more of the ischial space of her hip, and her left socket had definitely never formed, and I'm guessing her hip probably was never there to begin with. So we got the ball rolling, had a couple of consultations with a couple of different surgeons, and we ended up going to Cincinnati Children's Hospital. And Dr. Tamai was her surgeon. She had surgery in the middle of December of 2024. So we're still very early in this journey. She had a Salter osteotomy, a femoral shortening, a tendon shortening, spica cast for 12 weeks, which I am not sure how. I was there for maybe the first 4 weeks of her journey, and then her parents took over for the last 8 weeks. Family was super helpful, but it was a lot. She was not a small child, so lifting, transporting, toileting, putting to bed, bathing, hair care, keeping them occupied, for hours upon hours every day, making sure you're changing position because you don't want, skin breakdown to happen. But she's out of the cast. She was in what they call an Ortho America brace for 12 weeks, pretty much 23 hours a day. And now she's just in the oh my gosh, the brace. Sorry, gosh, a little brain fart there. She's in the brace only at night now, so she's pretty mobile. Doing really well. But again, we're probably, looking at future surgeries, and I don't know. It seems like a hip replacement will happen again, hopefully not until she's 30s, hopefully 40s. Like, I think 40s sounds like it's kind of the timeline that they look for most kids to, have a hip replacement. But again, we don't know if there's other surgeries along the way. But she's doing great, and hopefully she'll continue to do well. But I guess for her parents, I give them total props because they have 3 other kids. So there's one older sibling and 2 younger siblings, and it's a lot. And I think had the diagnosis come earlier, maybe, surgery could have been avoided, and the lifelong, and I don't even like the word disability, the lifelong implications that this has created for her. Although to look at her, you would probably never know, which is a beautiful thing as well. But only time will tell us what her future holds.
Well, I really appreciate you both sharing these very personal stories, and it's been amazing, as an adult patient with hip dysplasia, it's been really amazing to get to understand more the family side of it too, because this really is a condition that affects a huge spectrum, right? It's from infants all the way up through adults. So I think just being able to share all these different lenses and perspectives really shows what a significant diagnosis this can be, and the impact it can really have on so many people. And on that note, I mean, the reason we've all gotten to know each other is because you two really met each other and came together and said, we want to do something about this. So would love to have you share a little bit about that, about how you got to know one another and the advocacy work you're embarking on, and tell us a little bit about that this not little project, this huge project.
Yeah, it's growing. It's growing. Yeah, so having been in healthcare for 30 years, and my background is nursing, and nursing is just, you're always a patient advocate. You're always doing what's best for the patient. And so I think it's just kind of a natural progression for me. And so shortly after my granddaughter's diagnosis, um, I don't even remember how I found the DDH Facebook page. Oh, I do remember there was I'm in a nurse practitioner group, and I had said something in the nurse practitioner group about this diagnosis, and was just kind of like, oh my gosh, like now what? And so another mother who was kind of in our group for a short time, she's kind of off doing some other things that is speaking to her. She kind of led me to the DDH SpicaCast, or no, DDH hip dysplasia, children facing surgery, or SpicaCast. Great Facebook page. I had posted out there. Um, I just felt like the screening was inadequate. And, why are these things getting missed? And is there anybody out there advocating for these kids who don't have a voice? And so that was April of 2024. And Stephanie replied to that post, and she was like, "Yeah, I've been thinking about this whole advocacy thing." And so shortly after that, she and I started messaging, and we started, trying to brainstorm how we wanted to do this. And other parents had also expressed wanting to advocate as well. So through that, we started a more formal group in September of 2024. There's now a core group of 7 of us moms, and we're all in different backgrounds. We have one occupational therapy mom, we have a school teacher, a physician. She's actually a nephrologist. We have Stephanie, who her background, I'll let her speak more to that. So we have 2 attorneys, and then myself. So I think that's 7. So yeah, we're really excited about bringing advocacy to or hip dysplasia advocacy to parents, to providers, to providers from OBGYNs, to pediatricians, primary care doctors, obviously nurse practitioners, physical therapists, PAs, anybody who wants to learn and help advocate for these kids.
Yeah, that Kelly posted that wonderful post and really got things started for us as a group. I responded to her because, as Kelly said, I had been wanting to do advocacy work. I had recently taken some time off from my job to spend it with my family, but also, start to investigate how to become involved. Um, I was a class action civil rights litigator. So for me, it's really natural if someone has suffered a harm to look towards systemic causes. So what systemically um, could be tied to it? Who else has been harmed? How many people have been harmed? And have they been all harmed really in the same ways? And so, Kelly mentioned this DDH Facebook group, and there are thousands of people on in that group, and there are other groups too. And so, many of them, as she said, are posting, and they have really variations of the same basic story. Usually, there are risk factors or there are signs that are being overlooked or, dismissed by people who we hope could have some power to diagnose or to make a change or lead someone to a specialist for a diagnosis. And we saw that really happening over and being posted about over and over again. So then my professional training as the class action litigator is then what systemic remedies can we brainstorm and can we kind of create to stop this same harm from happening again? Who are the players that are involved? What's their role? What type of power do they have? How do we reach them? How do we, build a coalition? How do we come up with solutions together and then work to implement those systemic remedies, really? And that's looking at, issues that might have a really, long time frame. So, with civil rights and systemic, issues in general, that's you're looking at, decade long or two decade long cases in some instances, and long periods of implementation of remedies. And so, the scope here is not, overwhelming, and is, rather kind of exciting because there are so many opportunities here for, prevention of DDH, or, earlier diagnosis and better outcomes, and more effective treatment. So, right, as Kelly said, we've been working together for over a year. We're moving forward with the process to form this nonprofit, the Pediatric Hip Dysplasia Action Network. And we have a leadership that's comprised of, incredible, incredible people. So both patients and families, so we've got Kelly, we've got me, we have Angie Lobo, we have Angela Gannon, we have Mary Swain, who's a member of Miles for Hips as well, Crystal Anderson, and we also have you, Nancy, who has been critical also in helping us, brainstorm and figure out how to undertake these systemic remedies, and figure out what does our future work look like, what is going to best help patients, our families, and everyone we know who has and who we can reach in the United States for hip dysplasia. So we are, our planned programs are still taking shape, but we have DDH research. We have a family and caretaker education. We have provider education initiatives planned as well. We're hoping to do direct patient support, undertake a swaddling initiative, and then we also have public policy and other advocacy goals. So I'll start maybe just first with our DDH research program. I'm going to then hand it over to Kelly to talk about some of our other programs. But for our DDH research, we're going to be focusing on projects that we believe are essential kind of for developing a robust understanding of the current screening process in the United States. So understanding how effective is it? How effective are, the in-office physical exams? How many people are falling through the cracks, like our families have? And we think that this will really help set the stage for future advocacy initiatives. So understanding what is that impact when somebody does fall through the cracks, what is the cost, and how does that impact that individual? How does that impact their family? How does that really impact our healthcare system and society in general? I'm going to hand it over to Kelly to talk about a few of our other programs too.
Yeah, as Stephanie mentioned, one of them will be our family and caretaker education initiative, where our hope will be to educate the families, whoever is caring for the kids, about the signs and risk factors of DDH. And we hope that at every stage of a family's journey, from prenatal education, dialing it back to, when a woman's pregnant, like when they're at their OB visits, kind of helping them establish, are there any family history risk factors? Is this baby breech? Is there low amniotic fluid? All these risk factors that need to be addressed and understood early on, to care in the hospital, and then those who are in charge of their pediatric care, like I mentioned, be it a pediatrician, a primary care doctor, because, not everybody has access to a bigger city and more opportunities to get to a pediatric children's hospital. Another initiative that we're hoping to get to is provider education. We're looking at medical education, including medical school residencies, fellowships, conferences, and continuing medical education. We want to help providers help the patient, well, the parent of the patient, navigate the diagnosis from diagnosis through treatment. Because as we've all gone through this journey, the doctors don't really have much guidance past the surgical point. Like they put the spica cast on and they hand you over and send you home. And so we want to make sure that these parents and families are, given consistent information from their surgeons. And then we're even looking at some direct patient support programs where, that journey from diagnosis to treatment is difficult. And so we want to be kind of that touch point to kind of help these families through their journey. We want to help and prepare them for bracing, possibly the spica cast, and really any other ways that we can help navigate through these challenges. Stephanie will kind of touch on the other ones that we're currently working on as well.
Yeah, so our Safe Swaddling Initiative, I think we are very excited about that and to implement that on the sooner side. So we know that, right, in proper swaddling, when the legs can't move freely, that it contributes to the development of hip dysplasia, and that there should be hip flexion and abduction and knee flexion, and really the whole bottom half of the body should be free to move. And that when you allow for that, that decreases the risk of developing hip dysplasia. So we really feel like this goes towards, the prevention of DDH in our mission. So we're looking for ways to educate families about those safe swaddling practices. When in that journey, our caretakers most receptive to this type of messaging. And then also, there is that, that potentially that burden of costs to actually purchase a hip safe swaddle. So kind of ensuring that we can, ease access to these hip safe swaddles that are out there, or that we can adequately educate people so that they can implement, safe swaddling practices with the swaddles that they do receive at the hospital or from other locations as well. So our other public policy and advocacy initiatives that are planned are kind of looking at the current guidance that's directed to pediatricians and other doctors. We are looking at the in-office physical exams that are conducted. When are they conducted? Can anything be added to those to increase their accuracy? And then also, what are the current imaging recommendations and practices? When are people, recommended to go and get an ultrasound? When are they recommended to go get an X-ray? What is the timeline if that ultrasound shows that it's clear, but there is a history of risk factors and other signs? Are they then recommended to have a follow-up ultrasound or X-ray at a particular time? So we're really looking at those guidances. And using hopefully that the data we collect, we're hopeful to make, potentially engage in the process of reevaluating those guidances. And then we're looking at, if we are successful in getting, greater more imaging recommendations, and if the practice of imaging expands, then what structural changes are we going to need to make to make that a reality? So what kind of imaging, what is the current access to imaging equipment? What are the, professionals that are doing that, the techs, the interpretation, as well of those images? And how do we increase the access or the training on those images and increase the accuracy of reading those images? And then if imaging expands and more people are getting imaging or are recommended to getting imaging, is that covered by insurance? And so how do we then expand insurance coverage and ensure that the burden is reduced on families and they don't need to pay? And how do we work on ensuring that, all different types of insurance. So whether it's through private insurance or if it's through, a Medicaid or a similar program, that they can get this covered for families.
I just love it. And I think what I love about this team and kind of this vision and the goals is that, first of all, you're looking so much at all these different levels, and going, where can we intervene? And there's so many opportunities, right? There's at the immediate, the family level, the caregiver level, there's the level of the, prenatal care. But your house is like mine.
Nancy, this is the kitten.
Yeah, just to go back. But what I love about this program is just all the different avenues that you're thinking about, and thinking about that, there's all these different levels to intervene. There's room to intervene at the family level. There's, the parent level. There's room to intervene prenatally, postnatally, with the pediatricians, thinking about the physicians, what is their training like? And then you're also thinking systems and going to, if we do change, what does that look like, from a system standpoint. What I also love too, though, is that you've got these, great long-term visions, but that doesn't mean that there aren't things to do today, right? Because as we've been talking about hip dysplasia, we're going, yeah, I mean, the goal, right? I mean, the ultimate goal would be prevention.
Right.
The secondary goal is early diagnosis, because if we can diagnose early and treat early, hopefully really good long-term outcomes. And that you're not falling into situations like your families, where you're having these late diagnoses in childhood and undergoing these major surgeries and kind of a questionable, what does this look like from a future standpoint? Hopefully we're not, down the road, 40, 50, 60, however many years, we're not having people like me who are getting diagnosed in 30s and 40s and dealing with the repercussions in adulthood. So, I mean, just so many points of contact. And I love that this group is really thinking about all of that, and thinking there's a here and now, but there's also a then and a future and a, path forward. So it's just amazing. And, for the sake of time, because I know you both are, everybody's busy work schedules and life schedules, but I think you answered a couple of my questions. But I would love for you both just to share, what advice would you have for other patients and families who want to get involved in hip dysplasia advocacy and awareness? Because you really both are examples of people who have come forward and said, we're going to make a difference through this. But, for other families out there who might be watching this and going, wow, this is amazing. I'd like to be a part of some kind of movement around this. What advice would you have?
I mean, for me, I would say, kind of how Stephanie and I met, by reaching out to other like-minded individuals who just feel compelled to do this work. We've got to be, the voice for those children. Because when you're a child, you don't have that voice as you do when you are an adult. So I feel through that collaboration is where a big part of the change can happen. Even if you don't want to get involved at the deeper level that we're working at, there's always going to be a place where you can help. And so, just creating networks in your local community. If and when you have the opportunity to be part of a fundraiser, you could do that. We've also learned that, through social media outreach, we would have never met. This has opened up a whole new realm of opportunity through social media, through parenting accounts, other hip dysplasia accounts, and that's where we have found we can connect and learn from one another.
Yeah, I think Kelly hit it on the nail on the head. To be vocal about your experience and then reach out to people who want to join you. We're so much stronger together, really. And even looking towards the people who are already advocating, like we have, made a point and to reach out to those advocates who've been in the field for, decades. And everybody has been incredibly supportive and very welcoming, and has welcomed, the help. Gina J from One Hip World, your team at Miles for Hips, Nancy, the IHDI and Valerie Parrish, Hip Hope Network and Dr. Kish Mulpuri. Everybody has been so willing to spend hours on Zoom calls, with us. Brainstorming has been very willing and excited for, different perspectives, patient perspectives, family perspectives. So, look at the current advocates out there, see what they're doing, and reach out. So people could reach out to us. We would love that. Reach out to the Miles for Hips team. Join a local Miles for Hips chapter even. I think that there are communities out there that are really paving the way, and have a great support network there for people. So we are very grateful to you, Nancy, of course, for everything you've done for the community, paving the way, I think, for us and, for our, for my daughter, for Kelly's granddaughter, that you have improved so much already, the futures that they will have, and other hip dysplasia patients. And we are very grateful, of course, to you for being a partner with us in that advocacy work.
Well, it's so important. And obviously, I'm hugely biased in this, but I just feel so strongly that patients and families need to be involved. I mean, we are all, I think so much we look at ourselves as recipients of healthcare, but we really all need to be involved in the process of healthcare. And I think, I was having this discussion yesterday with one of the other team members and saying that, I'm so sorry for both of you and your families and the journeys you've been through, but taking these steps and coming together and wanting to make a difference, the doctors, the surgeons, the nurses, everybody cares, right? And everybody wants that same good outcome for your child and your family. But at the end of the day, it's at the reactive end of medicine, and it's the patients and the families who are frustrated, who are angry, who truly feel perhaps even an injustice or just recognize that lack of what could have been, right? Yeah. And I think coming together and finding these communities and partnering and saying, listen, we're recognizing a problem and we want to be a part of the solution. And I think it's an amazing way for patients and families to be, and to recognize that we have some power in this situation, and we have a lot of the experience matters, and the passion and the dedication and the determination all really matter. So I thank you all for everything you are doing. It is just, I tell people all the time, I'm like, this is just the most inspiring group of individuals, and just the passion and the dedication is just overwhelming, and it is just such an amazing thing to be a part of. So I hope others get to know all about you and experience this too. And on that note, I know there's a lot work in progress, but for people who are interested in learning more, how would you recommend either getting in touch, or I know there's some things coming to be able to follow, but would love you to share where we're at.
Yeah, well, we do have a current website, phdan.org. So we do welcome people to reach out to us on there. We're hopeful to build it out in the future, but for now, there is a contact us form, and we do receive the submissions via email. So we would love for people to go ahead, visit phdan.org, fill out that contact form, and let us know how they're interested in being involved. We are always happy to jump on a call or a Zoom call and chat and tell you more about our work, and brainstorm together about how you can join our advocacy.
Wonderful. And I'll make sure that link, or that the email link, is in when we share this as well.
Thank you, Nancy.
If we can find it. Yeah. Well, thank you both so much. This really was wonderful. And thank you for taking time out of busy life and work days. And I think everyone's going to really enjoy hearing about this work coming up. And we're super excited about it.
We're so grateful to you, Nancy. Thank you so much for having us on to be interviewed. Thank you.